thank you for joining the NeedyMeds special topic webinar, the PAN Foundation, Connecting Underinsured Patients with the Treatment They Need. My name is Carla. I am the Director of Education and Partnerships at NeedyMeds, and before we get started, I will go over a few tips. You can type any questions you may have into the questions section of your GoToWebinar control panel, but no, we will reserve answering questions until the end. If we don't have the time to answer your question, we will follow up with you personally via email. I will provide the contact information for NeedyMeds and the PAN Foundation at the end of the webinar. Also, this webinar is being recorded and will be available for viewing on our YouTube channel. And you can find the PowerPoint slide decks in the handout section of your control panel. So let's get started with what is NeedyMeds. What you are looking at is our mission statement, our vision statement, and how we achieve our mission. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do this free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. I always like to put up a screenshot of our homepage because really our website is the face of our organization. It also gives me a chance to point out a few resources. If you are interested in locating healthcare cost savings resources, check out the Patient Savings tab. To stay up to date on what's new at NeedyMeds, check out the Advocates tab. This is where you can sign up to receive webinar announcements, sign up for a monthly newsletter, now named Vitals, and order brochures. In the beginning, I mentioned that this webinar is being recorded. You will be able to find it on our YouTube channel, which is at the top right of our website with the other social media icons. And as you saw, a big part of our mission is education. And we define that by educating people about NeedyMeds and the resources we offer, but also by informing them of other resources such as the PAN Foundation, which is why we are so pleased to have our guests Audrey and Joan with us today. Let me tell you a little bit about PAN. PAN helps underinsured people with life-threatening, chronic, and rare diseases get the medications and treatment they need by paying for their out-of-pocket costs and advocating for improved access and affordability. Now let me tell you a bit about our guest host, Audrey Cordy and Dr. Joan Zhang. Audrey is the Manager of Provider Relations and helps to develop and implement PAN's provider outreach strategy. She has over 10 years of experience in the healthcare industry, focusing on insurance coverage, reimbursement, and access to care programs. She holds a Bachelor of Science degree in Business Marketing from Syracuse University. Dr. Joan Zhang is the Manager of Medical Affairs at PAN and reviews the clinical parameters of PAN's assistance programs and conducts outreach to pharmacies and related professional groups. She is a licensed pharmacist with a Doctor of Pharmacy degree from Shenandoah University, Bernard J. Dunn School of Pharmacy. So without further ado, I'm going to pass the mic and the screen to Audrey, hopefully seamlessly. While we do make that transition, you will just hear some silence while Joan and Audrey grab that screen. And as they do that, I want to remind you that if you have any questions throughout the presentation, you can go ahead and type them into that questions section of your GoToWebinar control panel. And with that, I'm going to let Audrey take it away. Thanks, everyone, and enjoy.
Hello, everyone. Thank you so much for joining us today to learn more about the Patient Access Network Foundation, or PAN for short. My name is Audrey. I am the Manager of Provider Relations here at PAN, and I am joined by my colleague, Dr. Joan Zhang, our Manager of Medical Affairs. Today, we'll walk you through what we do, why we do it, and how you can apply and receive assistance with PAN. First, let's start with why copay assistance is important. As you may already know, access to medically necessary treatment is critical for successful patient outcomes. However, this access is often blocked by high cost sharing, which can negatively impact both quality of life and the course of a disease. High cost sharing refers to healthcare expenses that are not covered by an individual's insurance plan and must be paid out of pocket by the patient. These out-of-pocket costs come in the form of deductibles, co-pays, and co-insurance. Patients who have insurance but are unable to afford the out-of-pocket costs associated with their treatment are considered underinsured. Additionally, you are considered underinsured if your treatment expenses are more than 10% of your annual income. For many patients with chronic, rare, or life-threatening diseases, this cost of care can add up quickly, putting many patients in the underinsured population, which is an estimated 25 to 30 million people in the United States alone. This chart shows that an estimated 20% of the underinsured population struggles with cost sharing of $10,000 or more each year. Furthermore, limited access to prescription medications exclude economically vulnerable patients from the benefits of new, specialty, high-cost generic, and other medically necessary high-cost prescription medications. Advancements in new therapies could also mean even higher prescription cost sharing, and this increase in burden will once again fall directly on the patient, which means that the patients who are already having difficulty paying their out-of-pocket expenses will also pay more to simply maintain their health care insurance. Not only do patients face high out-of-pocket costs, but most patients are hit with the highest out-of-pocket at the beginning of the year. In addition, it is unlikely that we will see any major structural changes to our healthcare system in the short term, and so cost sharing remains a high priority and a high risk for all of us. The Patient Access Network Foundation believes that cost sharing should not prevent anyone from medically necessary treatment, and so today we are going to tell you how PAN can help remove the financial barriers and alleviate high out-of-pocket costs for the underinsured. So with that, I will turn it over to Dr. Joan Zhang, who's going to tell you more.
Thank you, Audrey. Let me begin by telling you who we are and how to apply for assistance with PAN. The PAN Foundation is a nonprofit organization dedicated to helping federal and commercial insured patients by helping them pay their out-of-pocket expenses or cost-sharing expenses for their prescribed medications. We have 3 types of assistance programs. First, we have copay assistance programs, which include assistance with payments for deductibles, copays, and coinsurance. We also have premium assistance programs, which assist with the patient's insurance premium payments. And lastly, we have travel assistance programs, which help to cover the cost of approved transportation, lodging, and ancillary travel expenses incurred for your patient's treatment visits. All of our assistance programs are provided in the form of financial grants. Since its founding in 2004, PAN has provided nearly 1 million underinsured patients with over $3 billion in financial assistance through more than 60 disease-specific programs. Listed on this slide are some of the disease funds that we have available at the PAN Foundation. They range from chronic diseases to oncology and rare diseases. We recently added carcinoid syndrome and Waldenström macroglobulinemia to our list of disease funds. To see a full listing and current statuses for our programs, please visit our website at panfoundation.org. To qualify for assistance for one of our disease funds, the patient must meet the following criteria. 1. The patient must be getting treatment for the disease in which he or she is applying. This means that if you're applying for assistance with our asthma disease fund, the patient must be diagnosed with asthma and the medication you are seeking assistance with must be covered under our asthma fund formulary. 2. The patient must have health insurance that covers his or her qualifying medication or product. 3. The patient's medication or product must be listed on PAN's list of covered medications. 4. The patient's income must fall at or below the federal poverty level specified by the assistance program. It's important to note that the insurance and income criteria will vary for each program, so please be sure to verify this and all of the program guidelines on the Disease Fund pages at panfoundation.org. Finally, the patient must live and receive treatment in the United States or U.S. territories, although U.S. citizenship is not a requirement. If the patient meets all of the criteria listed on the previous slide, you will need to gather the following information before you start the application process. First, you will need the patient's demographic information, such as their name, address, phone number, and email address. You will also need the diagnosis and medication name, as well as the patient's health insurance information. You will also need the patient's income, number of people in their household, and the physician and the facility's contact information. Now you are ready to apply for assistance with PAN. There are two main ways to do this. You can either give us a call Monday through Friday from 9 a.m. to 7 p.m. Eastern Time at 866-316-7263, or you can log on to one of our 3 self-service portals listed here. As you can see, each portal is designed with the end user group in mind. The provider portal serves our healthcare providers, whereas our pharmacy portal is intended to serve our pharmacy personnel. And most importantly, our patient portal is designed to serve our patients and patient caregivers. On average, it takes about 7 minutes to complete an application, and our enrollment decision takes about 1 minute. We'll provide you with the enrollment information, and then we follow up with a fax enrollment letter to the physician, as well as a mailed letter to the patient advising them of enrollment details. Once you are enrolled, you may begin submitting claims to PAN immediately. We want the reimbursement process to be simple and quick for you, so we provide several ways for you to submit your claims. 1. If the patient receives their medication from a pharmacy, the pharmacy can bill PAN electronically or submit a claim via fax. 2. If the patient receives their medication from the doctor's office, the doctor can bill PAN electronically, by fax, or via the provider portal. 3. If the patient prefers to bill PAN directly, the patient can submit the prescription label or remittance advice for services rendered at the pharmacy, or an explanation of benefits for services rendered at the doctor's office, all along with a complete direct member reimbursement form. Additional information on filing claims can be found on our website at panfoundation.org under How to File a Claim for each user. We'll also make sure to communicate with you every step of the way until you receive your payment. Now that the patient is enrolled and is ready to submit claims, there are a few things to know about PAN's grants. Each PAN grant eligibility period is for 12 months. However, if the patient enrolls for the first time in any of our disease funds, we will help cover their claims incurred in the last 90 days before the date of enrollment. In addition, claims must be submitted every 120 days in order to keep the grant open. You may apply for a renewal grant with PAN after the 12-month eligibility period ends. PAN also offers additional assistance called second grants for all of our disease funds. This means that if the disease fund is open at PAN and the patient runs out of funding before their enrollment period ends, you can apply for a second grant to cover the remainder of the eligibility period. You may still have additional questions pertaining to your specific situation. Please contact us and we will assist you through every step of the process. We understand that managing an illness is difficult, and patients who apply for assistance with PAN may need additional support beyond financial assistance. You may also have questions about the disease, treatment, side effects, and medication adherence, as well as benefit from connecting with a compassionate community that can help patients deal with the physical and emotional complexities of their disease. That's why we have formed alliances with leading patient advocacy groups such as the American Liver Foundation and the Parkinson's Foundation, to name a few, to provide patients with the holistic support they need. These groups will reach out directly to patients who are interested in learning more. I'm really excited that I had this opportunity to tell you about our programs, and I hope you enroll with PAN to benefit from the assistance that we currently have available at the PAN Foundation. And now I will turn it back over to Audrey.
Thank you, Joan. We want to encourage you to stay connected with us once you enroll with PAN. We understand that you have a busy schedule, and because of that, we've made our process quick and simple for you to stay connected. We provide many resources to help you along the way. So one way to stay connected with PAN is through our patient portal. Here, you can apply to PAN by simply going to panapply.org to complete a short online application. Once enrolled, a patient or caregiver can manage their account, review their eligibility period and grant balance, sign up for a second grant if they are out of funds, renew their grant starting from 1 month before the date in which their eligibility period ends, and view correspondence letters regarding their accounts. All this can be done without having to pick up the phone. If you're a provider, you may also apply on behalf of your patient at providerportal.panfoundation.org. Here, you can utilize the same features as on the patient portal with some additional features, such as you can submit and view processed claims and run reports. You can also communicate with our portal support team via secure message. You can access all PAN correspondence letters regarding your patient's accounts, and then you can manage your facility's account. Pharmacies also can log on to the pharmacy portal at pharmacyportal.panfoundation.org and utilize the same features as on the provider portal, with the exception of claim submission. In addition, announcements and updates are displayed on both pharmacy and provider portal login pages. Another great resource is our website. We have designed specific sections for our providers, pharmacies, and most importantly, our patients. By navigating the top menu bar, you can access audience-specific tips and tools to find program information. For instance, on the provider and pharmacy section, we have a page on frequently asked questions, which provide further details about enrollment and claim submission. We also have short webinars about our programs on each section, as well as additional resources under the advocacy resource page. On the patient section, you will find a list of all our assistance programs, the fund eligibility criteria, and the fund formulary. Also, within the specific disease fund page, you will see referral information to other foundations if the disease fund is closed at PAN. To receive email notification when the disease fund opens, you can sign up for our fund reopen notification list on the portals or by calling us. In addition to the fund reopen notification list, PAN created a web-based app called Fund Finder. This is to help you track disease fund statuses across all of the 8 charitable copay assistance foundations. You can simply go to Fund Finder at panfoundation.org, or you can find a link on our website. Once you sign up, you can follow any disease fund and receive notification alerts via email or text message when the specific fund opens at any of the foundations. Fund Finder helps you save time by not having to frequently check multiple websites. Our goal here is to help you find the support and resources you need so you can spend less time on the manual work. We know that PAN Foundation is one of many resources to help patients, and so we encourage you to reach out to us. By doing so, we can listen to your needs and understand how we can help. Our contact information is listed on the screen. You can reach me directly at 202-370-4824, or you can email me at acorte@panfoundation.org. If you would like to sign up today, please contact our call center at 866-316-7263. We look forward to working with you soon, and thank you so much for your time. And at this time, I'll go ahead and turn it back over to Carla. Thank you.
Thank you so much, Audrey and Joan, for the thorough and easy to understand presentation. And no doubt our audience is seeing why we are so proud of our partnership with the PAN Foundation. A reminder to our audience that you could submit any questions you may have. I see some coming in already into that question section of your GoToWebinar control panel. A reminder, if we don't answer your question today, we will follow up with you via email. And while those questions are coming in, I will go ahead and say that we do hope you rely on NeedyMeds as a source of support as well. On your screen are our most popular and cost-effective healthcare cost savings resources that we do hope you take advantage of. And again, you can find all of those under that patient savings tab that I pointed out in the beginning of the presentation. And to learn more, you can sign up for one of our upcoming monthly overview webinars. And you can find those on the calendar of events on the bottom right hand of the NeedyMeds homepage. Or if you are looking for help affording a specific medication or healthcare expense, you can always reach out to our call center counselors at 1-800-503-6897, available Monday through Friday, 9 to 5. Just remember, we are located in Massachusetts on East Coast time. So let's go ahead and get to those questions coming in. And as I do, I will leave up the contact information for both the PAN Foundation and NeedyMeds as promised. So Joan and Audrey, one of the first questions coming in is, can I sign up for the Fund Finder if I don't have an email account?
So you will need an email address when you initially sign up for Fund Finder. This is because we send an email to verify your registration once you sign up. However, once you sign up, you can opt to receive only text messages notification instead of email.
So helpful. Thanks for the thorough response, and to our audience member for asking that question. Another question coming in is, how do I check to make sure my medication will be covered before I apply to PAN?
To check if your medication is covered at PAN, you can find our formulary on our website at panfoundation.org. You may refer to the specific disease fund programs for a list of all the medications covered for that program.
And I will also add, just as I always encourage people to reach out to our call center at NeedyMeds at 1-800-503-6897, we also encourage you to reach out to the call center at the PAN Foundation. And again, that number is on your screen, which is 1-866-316-7263. And they can also answer any questions you may have. Another question coming in is, when applying for assistance, do I need to provide any paper documents to verify my income? That's a great question.
No, typically our application takes about 7 minutes. You will need your household income information along with other demographic, provider, and medication information. If paper documentation is needed later on during the income verification process, PAN will follow up with you to advise you of what information needs to be sent to us.
So helpful. Another question coming in that you may get a lot, Audrey and Joan, is why do I have to submit a claim every 120 days to keep my grant?
That's a good question. So we want to make sure that you're using your grant as intended. So if we don't receive a paid claim within 4 months of enrollment, we will cancel the grant and make it available to another patient who is in need. However, we will send you a notification around the 90th day so that we can alert you that we haven't received any claims from you, or we don't have any paid claims on file for you. But if you have any extenuating circumstances that prevent you from submitting claims within that 120 days, you can give us a call, and then we can move forward and see if we can go ahead and assist you further. I also wanted to point out that 120 days is every 120 days after a paid claim.
That's an important distinction. And we're going to go ahead and wrap up the question segment with one final question, which you may also get quite a bit, which is, how often are PANS programs available?
PANS assistance programs are available when we receive funding for the program. Once funding is received, PAN opens the fund as soon as possible. However, there is no way to know when funding will be available, as we rely on generous donations.
So we do try to keep the question segment brief, so thank you to Audrey and Joan for answering those questions so thoroughly and succinctly. So if our audience members did ask a question that we did not get the chance to answer, as I said, we will certainly follow up with you via email. Or if you need an immediate response, again, you can reach out to the PAN Foundation's call center or the call center at NeedyMeds. With that, thanks again for taking the time to join us, and we do hope that you stay in touch. Thank you, Audrey and Joan, for that great presentation, and have a great afternoon, everyone. Take care.
Thank you, Carla.
Thank you, Carla. Thanks, everyone.
Have a great afternoon, everyone.